Hello, Stella. Welcome. Would you like to introduce yourself?
Yes, hello. My name is Stella Charman. I'm the Executive Director of a small charity called Action for Child Trauma International, and we've been working with Children Change Colombia for about 3 years now.
Lovely. So Stella, could you explain in a nutshell the work that ACTI does and why it's so important?
Well, our mission is to help some of the millions of children who suffer from the impact of conflict and violence all over the world. And as a result of that, suffer from the symptoms of trauma and are trapped into a cycle of suffering, because if they are not helped and treated, they'll grow up to be troubled and damaged adults. So we provide local people and their communities with the skills to treat and help children suffering from trauma symptoms and enable them to live as normal a life again as possible in the future. In addition to the training for treatment, we train those people to become trainers of others. So it's like a snowball. We can have a sustainable training program.
And I think that's really important, having the sustainability there. And that's something you're implementing with Children Change Colombia, and the staff that we have on the ground working with the children in Colombia. Could you tell us a bit more about the work you're doing with us to support children in Colombia?
Yes, of course. After our introduction to Children Change Colombia, I think it was been in about 2019, we did an introductory session the following year for any of the staff working in the project supported by Children Change Colombia, to give them a flavour of the sort of things we had to offer and the knowledge about trauma and how that might be affecting the behaviour of the children that they were working with in their various projects. So after that introductory session, which was online, of course, about 25 people signed up for a group program, which was run by 3 Spanish-speaking psychologists, and we taught them the group program. And then the following year, 2 of those 2 psychologists went out to Bogota and taught, I think it was 20 people, to deliver one-to-one treatment, which is called Children's Accelerated Trauma Treatment, which is a specialist treatment for the children with the most severe problems. And that's kind of where we've got to, and we're planning now a follow-up trip sometime later in 2023 for those people who have picked up on that, and to train them to be trainers and to extend the training to others.
Brilliant. And is it kind of, do you teach them, how do the workshops work? Do they learn, what kind of tools do you teach the trainers to work with the kids?
Well, the group workshop is a program which was actually developed by Children and War about 10-15 years ago to be delivered by teachers in classrooms to help children resolve their own issues of anxiety and worry. But of course, that group program will always leave a few with more severe difficulties who can't cope. And so our one-to-one treatment, which is Children's Accelerated Trauma Treatment, CAT for short, gives the therapist the ability to process the traumatic memory. So it's a trauma treatment, one-to-one trauma treatment that's based on all the most modern up-to-date principles of neuroscience and memory reprocessing for trauma. And there are other approaches which are used with adults, but ours is designed especially for children by children.
Amazing. That sounds, is brilliant work that you do. The last question I have is, how is treating trauma in children different from treating trauma in adults?
Well, fundamentally, children's brains are developing, so they have the same structures as the adult brain. But of course, with children, you can bring them together easily into groups because many children are in school, in classrooms. So you can do the group work, which very often is a bit harder to do with adults. So that's why a number of approaches which are well evidence-based, are based on group interventions. But our additional contribution really is this one-to-one treatment. And the problem with doing that using standard trauma treatment techniques is that they're often very heavily based on the ability to talk and explain what's happened to you. And it expects the person being treated to have quite a lot of trust in the therapist. So if you can imagine children who've been through bad experiences, they're very unlikely to trust somebody, particularly if they don't know them very well. They don't automatically know what a psychologist or a therapist is. So trust has to be built up between the counsellor and the child, and it may take longer, and you have to use other techniques to kind of build that. And then the other thing about children, of course, is concentration is less. So you've got to sustain their engagement by using playful, fun techniques. And hence CAT is based on an arts play methodology, which enables the child to feel really comfortable and to enjoy the sessions. And then the third thing really is, as I mentioned earlier, many children may not be able to talk about what's happened to them. They may have limited vocabulary. They may have a learning or disability or difficulty that means that they can't use the right words. So what we do is we get them to tell their story using characters, to play through what's happened to them through the medium of things that they've created, art, pictures, and that really helps them to tell their story. And sometimes they don't even have to talk. They don't even have to speak while they're doing it. As long as the memory processing is going on while they're playing out their story, then that memory work is being effective. It's a very clever technique, actually, and one which is much enjoyed by the therapist and the child.